All right, everyone, welcome back. Another episode of Goodreads. In the first episode on the series on left bundle branch blocks, we talked about conduction anatomy, and we started to understand why in lead V1 we have these deep S waves and why in V6 we have these prominent R waves. So if you're just catching up, go back, watch the 4 or 5 minute video on there on the conduction anatomy to understand why we see what we see. But in this episode, I want to talk a little bit more about clinical context. So how do we interpret the left bundle branch block? How do we apply it to and do some clinical correlations to it? So here's a 12 lead. This is a normal left bundle branch block. I want to talk about that. But in V1, we can see this deep S wave here in V1. We have a prominent R wave in V6. QRS is greater than 120 milliseconds. So when we're presented with a left bundle branch block, the question that we need to ask ourselves is the law of appropriate discordance there? So the easiest way to explain this is the law of appropriate discordance just means there should be opposites. So what that means is that if you have a negative QRS complex, you should see some degree of ST segment elevation or the J point going back to the isoelectric baseline. So negative QRS complex should have some degree of ST segment elevation, right? They're opposite there. So negative QRS, ST segment elevation, and or back to the isoelectric baseline, that's allowed. And then the vice versa is true. If there's a positive QRS complex, there should be some ST segment depression, or the J point goes back to the isoelectric baseline. So there should be appropriate discordance. There should be opposites there. So let's look at a couple examples. This is all part of a normal left bundle branch block. So again, let's take the example that we just had from the first one. We have a negative QRS complex. We see some degree of ST segment elevation. That's normal. Now, in the future videos, we'll talk about, well, how much ST segment elevation is allowed. And that's when we're going to start to get into something known as Sgarbossa criteria. But to identify what's not right, we need to be able to identify what is normal on the left bundle. So again, we see negative QRS complex, some degree of ST segment elevation. We see mostly negative QRS complex here, and then we see it going back to the isoelectric baseline. And let's see, we have positive QRS complex, and we have the J point going back to the isoelectric baseline, although this kind of looks just below, so some degree of ST segment depression. Okay, going on to another example. So what do we see here? We see negative QRS complex, some degree of ST segment elevation, totally normal, right? In V4, QRS is negative, goes right back to the isoelectric baseline, completely normal. Now, one thing, and the reason I liked this 12 lead is I wanted to point out in AVR, where is our J point? And if at any time that you're asking yourself this question, is that notching on the QRS complex, where is the actual J point? One thing that I like to do is in this case, in AVR, you can look at the lead directly below it or above it, depending on whatever lead you're looking at. So let's look at AVL. We can clearly see that the J point is here. So if we take a line all the way up, that is actually your J point. So this is your J point. That's your J point. So let me clear some of this up a little bit. But look at the lead right below it. Draw a line straight up from there, and that should be your J point. All right, so in AVR, we see a negative deflecting QRS and a J point that goes back to the isoelectric baseline. So this is all part of a normal left bundle branch block. We just need to ask ourselves, and in order to ask that question, is there appropriate discordance? If there's a negative QRS complex, is there some degree of ST segment elevation, or does it go back to the isoelectric baseline? If it's a positive QRS complex, is there some degree of ST segment depression, or does it go back to the isoelectric baseline? If you can answer yes to those questions, then it's normal. Now, in the next episode, we're going to introduce Sgarbossa criteria, and that's the rules for what happens when we deviate from this appropriate discordance.